Hi, my name is Katora Smith, and I'll be giving a summary or recap of our lit reviews that we found. I'm working with my partner, Alyssa Abramson, and we are doing the effects of physical activity on cancer patients undergoing treatment. In our first finding in Adamson's study, he did a research study on the recapture, body control, and self-identity. With the disease of cancer, he found that it destroys the body mentally, emotionally, and even physically. The patient feels weak and defeated, and they feel that they have no identity at all. And with this, the patient needs to have a support system to help them through this. Patients are abused and violated with the needle treatments, and this gives a negative effect on the patient through their body appearance and their performance as well. Chemotherapy is also a painful treatment because it kills the cancer, but it also kills the good cells as well. The main focus that we're on right now is exercise, and Adamson found that it helps with the symptoms and side effects, such as the increase in VO2 max, decrease in body mass index, and the release of chemicals, which in this case it's endorphins, which helps the well-being of the patient. The second study in McTiernan's, he found the outcomes of the physical activity and what it does. There's improvements in fitness, musculoskeletal problems, immune system function, cognitive, and sleep. Other beneficial effects are in the cardiovascular and endocrine systems, which decreases cardiovascular disease and cerebral vascular disease, as well as diabetes. The third finding that we found was in Schwartz, who did a study on weight gain of 78 female breast cancer patients who were undergoing chemotherapy. The results found were that the patients that adhered to the program decreased in fatigue and 50% increase in functional ability. There was also a greater weight gain and greater BMI in those who didn't exercise in that program. Overall, in our findings, we found that exercising improves mood, there's less anxiety, less depression, less fatigue, high self-esteem, self-efficacy, and increase in survivorship. What was key that we found was that the research needs to be more on how much exercise that patient should get and how much intensity and how much it will yield the benefits and enhance the quality of life, as well as decrease the fatigue, the chance of reoccurrence, and the restoration and elevation of the body. Some key ways to help with exercise. In the future, we found that it should be used to treat problems directly and not just to manage the symptoms and side effects. The doctors should include exercise in their programs to help benefit the patient, and fitness programs should be tailored to the person's illness, treatments, and previous fitness level. And lastly, stated that there's a need for hospitals to base their exercise programs on the actual patient. And that's it.